Welcome to our video about fungus under breasts. Fungus under breast, symptoms, causes, treatments, and prevention. If you have noticed that your breasts aren't looking as healthy as they should be, you may have a yeast infection under the skin. If so, you should learn more about the symptoms, causes, treatments, and prevention. In addition to getting to the bottom of the fungus, you should also get a supportive cotton bra. Changing clothes promptly after sweating or swimming is also important. In addition to these simple tips, you should also wash your breasts regularly. Symptoms. Although there is no single definitive test for fungus infection of the breast, the symptoms of this condition should be characterized by pain, tenderness, and itching. The symptoms should disappear within a week or two, or if they are persistent, they may require a stronger prescription. It is important to seek treatment as soon as possible because the symptoms of this condition can recur during breastfeeding. In addition to pain, women should also pay attention to their hygiene to avoid spreading the fungus. The first symptom of this condition is breast pain. This can be accompanied by burning, itching, and crusting. The condition may also lead to bleeding and pain. It will worsen if the infected area becomes infected. If left untreated, the fungus can even spread to the breast. In severe cases, breast fungus can become so severe that it can affect women who are not lactating. Yeast, or candida, is the primary culprit. It lives inside and outside the body and thrives in moist, warm places. The breast is a prime breeding ground for candida. Fortunately, most people don't get affected by candida. However, if the fungus is present, it can cause a rash and even breast infection. Antifungal medication can help treat these symptoms, but it should not be relied upon. In addition to the rash, women suffering from this condition must pay attention to the nipple and breast pain. A woman's breast pain can also be caused by vaginal yeast infections. However, these conditions are not contagious and are only possible when the flora in the skin is out of balance. Some women may experience the symptoms of breast fungus during the first week after childbirth, but not all of them have it. Yeast infection of the breasts may also be accompanied by skin problems such as a rash or a painful itchy sensation. If you notice any of these symptoms, you should see a dermatologist or lactation consultant. In some cases, these symptoms may be caused by a different skin condition, but a dermatologist or a lactation consultant can distinguish between these conditions. Yeast infections are caused by an imbalance of the immune system that enables the fungus to thrive in warm, moist environments. Causes. There are several causes of fungus under the breast. A woman suffering from diabetes should avoid wearing tight clothing to the breast because it traps moisture and can contribute to yeast infections. In addition, women should use supportive cotton bras. Women with diabetes should also avoid high-fat diets because excess body fat can lead to skin folds. Treatment for this infection usually involves antifungals. Generally, however, it is not serious. Candida is the most common cause of fungus infections, which can occur anywhere on the body. Candida thrives in warm, moist areas, including under the breasts. Although most women do not develop this condition, it can affect certain people who have poor immune systems. If you experience a rash or a sore, try to avoid wearing tight or loose clothing for a while. You may also experience a foul smell. Usually, the fungus under the breast does not cause significant complications, but it is worth mentioning. Overweight women may have deeper skin folds, which can be more vulnerable to yeast infections. Additionally, women with diabetes may have more prone to developing yeast infections. This may be due to uncontrolled blood sugar. Similarly, women with large breasts are more likely to rub against their upper torso, which may also result in an intertrigo rash and a possible yeast infection. The skin underneath large breasts is harder to keep dry and well ventilated, which may be one of the main causes of fungus under the breast. Antifungal creams, barrier creams, and steroid creams may help treat the rash and prevent a recurrence. Ask your doctor or pharmacist about specific treatments. It is also important to wash the area under the breast thoroughly every morning and night with gentle soap and an emulsifying ointment. If the rash is not bothersome, skipping wearing a bra may be enough. Measles is another cause of a rash under the breasts. This infectious disease causes red, swollen, and itchy skin on the breasts. It is similar to the symptoms of a common cold, including fever, runny nose, and eye irritation. Managing the rash and preventing complications are essential. A doctor can give you medication and a prescription cream to treat the infection. Treatments. There are a number of home remedies for treating fungus under the breast. While these may help to alleviate some of the symptoms, they should never replace medical attention. The doctor will prescribe a medication to treat the infection, called fluconazole, which is a triazole antifungal agent. Fluconazole can pass through breast milk in very small amounts, so the medication is considered safe to use while breastfeeding. The skin folds under the breasts are perfect breeding grounds for bacterial and fungal infections. Yeast likes warm, moist areas, which is why it prefers breasts and nipples. Candida usually does not cause symptoms, but if the infection is severe, the skin can break down and allow the yeast to penetrate the breast folds. The symptoms of a yeast infection are a combination of pain and itchiness. Personal hygiene is important to treat and prevent a fungal infection. Avoid wearing tight clothing around the breast fold to prevent moisture and dirt from building up. If you have a yeast infection, make sure to wash your underarms regularly. A combination of steroid and antifungal creams can help treat the itchy rashes and generally improve your symptoms within a week. The combination creams can be purchased over the counter or prescribed. Another common rash is heat rash, which occurs when sweat glands become blocked and pool under the breast. It is another type of rash caused by an infection, known as hidradenitis suppurativa. Both rashes are characterized by itchy, red bumps that can appear anywhere on the body. The rashes are painful, and they can spread quickly, so it's important to seek medical attention for these symptoms as soon as possible. There are several treatment options available for fungus under the breast. A medical professional may recommend a topical cream, steroid injection, or an oral antibiotic to control the infection. The best option for you depends on the severity and underlying cause of the infection. Antifungal creams, antibacterial creams, or barrier creams are some of the treatments for fungus under the breast. Changing your lifestyle can help reduce the chances of getting the condition and reduce your discomfort. Prevention. If you have a history of fungal infections, prevention of fungus under the breast is essential. This bacterial infection does not cause any major complications but can result in dark discoloration of the skin. It may also cause pain. Some women may experience itching or rashes or may even experience a slight discharge under their breasts. The infection can also result in an unpleasant odor. To avoid a fungal infection under your breast, follow these tips. First, you should wash the skin under your breasts regularly and prevent the development of new patches. You should also avoid sweaty and wet clothes. This condition can be caused by an imbalance of the normal skin flora. It can also be passed to other people. Pregnant women should also avoid wearing tops that do not allow breastfeeding. The affected area may crack or bleed. Antifungals are available over the counter and may be applied as needed. Another way to prevent fungus under your breasts is to avoid wearing tight or non-breathable undergarments. Undergarments that do not absorb moisture can hold it next to your skin, causing an outbreak. In addition, tight clothing can cause a skin rash. Yeast thrives in warm, moist environments, and this can be a problem for some women. If your breasts are too big, they can rub on your upper torso, creating the risk of a yeast infection. Obese women can also suffer from this condition because their body has folds and fat underneath their breasts. Preventing a rash under your breast is a major part of preventing a fungal infection. Symptoms of a fungal infection include irritation of the skin and rashes. In severe cases, the rashes can turn into blisters or open sores. If you suspect you may have a fungal infection under your breast, seek medical attention to rule out underlying conditions. This way, you can prevent it before it spreads out and causes a serious problem. Thank you for watching. Please like, comment, and subscribe if this was helpful.